Our case today involves a mom who's worried that her 8-year-old son might have ADHD. How confident are you in assessing ADHD? Hey GP trainees, my name is Dr. Erwin Kwun. I have doctors pass their SCA so they can finish training. Today you'll learn how to assess and manage ADHD. First things first, what exactly is ADHD? Attention Deficit Hyperactivity Disorder is a neurodevelopmental condition that affects both children and adults. It's characterized by three core symptoms: inattention, hyperactivity, and impulsivity. Not everyone who is a bit fidgety or is struggling to focus has ADHD. So when should you suspect ADHD? If a symptom started before 12 years old, persists for at least 6 months, and affect social life, school, or work. ADHD manifests differently in different people. In some, it might look like constant daydreaming and forgetfulness. In others, it might be hyperactive behaviors or impulsive decision making. The key is to be aware of this variation so you can take a relevant history. So let's talk about some of the common symptoms of ADHD that can often get missed or misunderstood. These aren't just quirks or personality traits. They can seriously impact someone's day-to-day life, whether in school, at work, or just getting through their daily routine. For instance, one of the hallmark signs is struggling to pay close attention to detail. You might see this in patients who make what seem like careless mistake in a work or school assignment. It's not because they are not smart or don't care. It's simply because their mind might be jumping from one thing to another, making it hard to focus. Another big one is difficulty maintaining concentration. Imagine trying to get through a task but constantly feeling like your brain is pulling you in 100 different directions. It's not just being distracted by what's going on around them. Sometimes it's their own thoughts that are the distraction. Ever had a conversation where it seems like the person isn't really listening? Like they're physically present but mentally checked out. That's another classic sign, appearing not to listen even when there's no obvious distraction. And then there's the struggle with following through on instructions or finishing tasks. This isn't because of a rebellious streak or because they didn't understand the instructions. It's more about how difficult it can be to maintain the focus needed to complete the task. Organizing tasks is a real challenge for many with ADHD, whether it's keeping a to-do list or planning out steps to complete a project. Organization can feel like an uphill battle. This often leads to avoiding tasks that require sustained mental effort. If something is going to take a lot of concentration, the natural instinct might be to put it off or avoid it altogether. Losing items is another common issue. We're talking about everyday things like keys, phones, or even important documents, items that are essential for getting through the day. And let's not forget about being easily distracted by extraneous stimuli, whether it's a noise in the background or even a stray thought that suddenly seems more interesting than what they're supposed to be focusing on. Finally, there's forgetfulness in daily activities. This isn't just about occasionally forgetting where you put your keys. It's a consistent pattern of forgetting important tasks or appointments. Alright, let's dive into the hyperactivity symptoms of ADHD. These are the behaviors that can be a little more visible, but they're often misunderstood. First up, fidgeting. You know the type: tapping fingers, tapping feet, squirming in the chair. It's like their body is constantly in motion, even when they're supposed to be still. And speaking of staying still, you might notice that some patients just can't seem to stay seated when it's expected. Whether it's in a classroom or a meeting, they're up and out of their seat before they even realize it. And then there's a classic sign of running or climbing in situations where it's not really appropriate. Now, this might be more obvious in kids, but even in adults with ADHD often describe a feeling of restlessness, like they always need to be moving or doing something. Playing quietly, that can be a real challenge for someone with ADHD, whether it's a game, a hobby, or even just relaxing, being calm, and still doesn't come naturally to them. They're often described as being on the go or acting like they're driven by a motor. It's that sense of constant energy that can be exhausting for everyone around them, and sometimes for themselves too. Now let's talk about talking. We all know someone who talks a lot, but with ADHD, it's more than just being chatty. It's talking excessively, often without realizing it, and sometimes blurting out answers before the questions even finish. This can be especially tricky in a classroom or work setting where patience is expected, waiting their turn. That's another one. Patience isn't exactly their strong suit, and it can show up in ways like struggling to wait in line or jumping ahead in conversation. And this ties right into the last point. interrupting or intruding on others, whether it's cutting someone off mid-sentence or jumping into someone else's activity. There is an impulse to act quickly and difficulty in holding back. When it comes to assessing ADHD, a focused history is vital. So ask the patient or the parent in the case of this mom who's worried about the onset of the symptom. When did they first notice difficulties with attention, hyperactivity, or impulsivity? What is the duration of these symptoms? Are these symptoms consistent across different settings like school and home or work? One of the most powerful tools we have is understanding where our patients or the parents are coming from. It's about really listening to their thoughts, worries, and hopes. When we take the time to explore these feelings, we're not just gathering information, we're getting a glimpse into the world. That's where the real magic happens. By understanding their perspective, we can truly address their needs and support them in the most meaningful way. Now, I know you've probably heard about ICE, ideas, concerns, and expectations before. It's a concept that's become so common, it can sometimes feel like just another box to tick off. But let's shift that mindset. Eliciting ICE isn't just a task, it's an opportunity to see the world through the patient's eyes or their parents' eyes. Knowing what question to ask is crucial. So, asking a patient or the parent, did you have any idea, is not a great question because it is a closed question and might not yield much. A better question is asking, what thoughts have you had about this? This question invites a detailed comment and is likely to enable a conversation about the patient's ideas or the parent's ideas. Asking, do you have any concern about this, is a closed question again. So a better question would be, what worries did you have about this? When it comes to expectation, sometimes if you ask a patient or the parent, what are you expecting me to do about this? It might sound dismissive or uncaring. A better question is asking, what were you hoping from this conversation today? Make sure that you've got the right tonality in your voice, and this will sound that you're caring on or interested in what's going on and what you can do to help. It might be worth asking about the development of the child so that you can get an idea about how the child has been achieving the milestone, whether there's been any other issues. It's vital that we rule out other conditions as part of the ADHD assessment. Oftentimes, this coexists with other conditions like anxiety, depression, or learning disabilities. So we've covered the first bucket, which is idea, concern, expectation, the patient's biomedical history. The next bucket is assessing the psychosocial situation and occupation. Are you feeling unsure about the SCA? Maybe you don't know what to do or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA blueprint, click the link down in the description below to get access to the SCA blueprint that GP trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it. It's vital that we understand how a condition is affecting a patient's life. Make sure you evaluate any environmental factors such as changes at home or school that could be affecting the child's behavior. Are they struggling academically or professionally? Is a social life impacted? How are things at school? Especially when a child has suspicion of ADHD, it could be where school might report something. So it's worth asking about whether the teacher have noticed anything. This will help in building the picture. Readdressing mom's ideas, concern, expectations is important before we get into shared decision making. So it's important that you and the mom are on the same page. So be empathetic and support the mother who might be very concerned about her son. So explain what you're thinking and communicate what can be done about it. So then you can explain about the process of making an assessment and how we can support her son and the steps involved in assessment. This includes school reports, behavioral observations, and possibility for a referral to a pediatrician or a child psychologist. So it's important that you discuss the importance of a holistic approach, including input from teachers and consideration of any learning difficulties. If symptoms have an adverse effect on the child's development or family life, then you could consider watchful waiting for up to 10 weeks and encourage self-help and simple behavior management. You could also offer parents or carers a referral to ADHD focus group. However, if the symptoms are severe, you're thinking that a watchful waiting is not acceptable, consider referral to camps or specialist services such as pediatrician. There's a good chance that parents have done a bit of reading on ADHD before speaking with a doctor, so make sure that you understand what is the health agenda, what's understanding. Sometimes people may have read about medication such as methylphenidate or Ritalin, so you might need to discuss medications as well. Methylphenidate is usually a first-line treatment for ADHD initiated by specialist ADHD service. Common side effects of methylphenidate include abdominal pain, nausea and vomiting. It can also cause tachycardia, palpitation. It can also affect the central nervous system, so could lead to insomnia, nervousness. Patients who are on drug treatment for ADHD need to be monitored. They need to have their weight and height measured, blood pressure and heart rate checked regularly. It might be helpful to signpost the parent to the National Attention Deficit Disorder Information and Support Service for further information that they could read on. If you found this video useful, you might want to watch the next video. It's a case demonstration of a patient presenting with low mood. Click here to watch it. Take care everybody. Bye bye.